So we are now done with the three presentation, moving on to the moderated discussions. Want to reiterate that all the slides will be shared, will be posted. So if you want to miss some details, we'll always go back to that. Maybe at this point, I'll open the floor and see if there's any raised hands from committee members, so they get a first take of asking a full couple of questions for our speakers. And I think, Brett, you have a raised hand for Jeff. Is that right?
Yes, I was just looking for the raise hand even after all this time.
Okay, all right. Well, I was just calling you and you can ask your question.
Thank you. So Jeff, I love what you've done. It's wonderful to lay that out. You had a great slide showing the performance degradation, and notably the electric filters did much better initially, but then over time degraded. So a couple of questions. Number one, what does that say about a recommendation perhaps could someone use that information to just buy electric filters and replace them more frequently so that they get the benefit of that new filter charge? And you give ballpark numbers, and obviously it's going to differ for the amount of particles you have in your house and what the particles are, but in terms of how frequent that filter replacement might be under some different conditions.
So I think in principle, replacing filters more frequently than we do is a great idea. And in fact, you know, if I could get people to change their filters, we would be a long way towards being in a better place. On the specific issue of electret filters, the effect can happen very fast. It's been documented in the literature to happen within a few hours in some cases, depending on the loading. I would point out that all of the homes in our study, or not all, but many of them had less than 100 hours of runtime. And so that degradation does happen relatively fast in some cases. The other comment I would make, though, about it is that the bigger picture issues of things like bypass are really important to address too. So for example, I would rather someone, rather than replacing their filter twice as frequently, you know, invest in a sealed filter rack that holds it there without bypass. And so, you know, but yes, in principle, replacing it frequently, great idea.
I mean, bypass is a thing we see all the time in commercial, in residential. What is needed to, and it's a problem that's known to researchers and private practitioners too, what's needed to move us to a more quality installation?
Yeah, I mean, I've actually been surprised. Every home I've ever lived in, I've addressed bypass, and I've been surprised how cheap it is to get it addressed. So it just basically means putting in a filter rack that somehow is gasketed and holds the filter in place. And, you know, so, I mean, that's really what it is. I think we have to have some education around consumers to value that, as well as installers to do that. But, you know, I think that's all that's really fundamentally needed.
Right, while we have you on the mic, there's a couple of questions about surrounding COVID. There's guidance on using MERV 13 or higher filters in our homes as a mitigation measure for COVID. But what if they don't, and what's your take on the effectiveness of that strategy? And what else we should be careful about when we use filter as a mitigation?
Yeah. So the first comment I'll make, and I saw this in the chat, and so I'll address it directly. You know, the virus is very small, much smaller than many of the particles I saw in my research, and so people think that, well, can the filter even work? And the answer to that is, if the virus were by itself, it would in fact be quite vulnerable and be not very likely to transfer infectivity. Instead, it's part of a droplet or a particle that's much bigger in size. So the real question is the filter removing what you care about? And a lot of virus transmission happens in 1 to 3 micron particles or so. And that is the kind of middle range on the ASHRAE 52 standard, and a MERV 13 filter has 85% single pass efficiency for that size. So I would say that filters can be an effective part of the strategy. And we in fact know that there's, at this point, maybe a half dozen, maybe more papers that have recovered virus RNA, and in some cases virus DNA for DNA viruses from filters. So filters can remove viruses. And I think that the real question is all the same stuff that I talked about. Are you using it well? I mean, if you have a MERV13 filter and your system runs 10% of the time, then 90% of the time, it doesn't matter that you have a MERV13 filter. If your filter has a lot of bypass, if you're not changing that filter, you're running into other issues. And so I always say, yeah, use a MERV13 filter, use it well. But if you can't use a MERV13 filter for a variety of reasons, you can use a lower efficiency filter, you'll still get some protection, but using it well is the important piece.
Thank you. Any comments from the other two speakers on this topic on everyone's mind?
Yeah, I think there's a consistent through all three of the talks and alluded from prior is engineering controls are wonderful. Right now, a lot of the engineering controls we have require some interaction by the people living in the space or managing the space. In a school would be obviously the facility staff needs to set up, make sure the equipment's maintained well. In your house, there's, even relatively minimal things are not done. But I think I like that, Jeff, you point out that this is not a big expense. Many people can afford it. Certainly property owners should be almost required to do it, I would say. It's something that could be required. But then, changing the filters, keeping up it is an expense that could be significant for some people. But I think for many people, it's at a level that could be afforded. A decent MERV13 filter you can buy for, I think, under $10 for most residential systems. And if if you have the capacity to buy a pack of them, significantly cheaper than that even, so.
I think on that, from the perspective of the school district we work with, I think the primary concern from this advanced air cleaning system that went into one of the schools in the Portland Public Schools school district was this issue of maintenance and recurring costs that are associated with the installation of the system. So I think there certainly is, on the school and the facility side, like Brett just mentioned, there's a facilities, team that deals with these issues, and they're, I think, have the know-how and knowledge to address a lot of these issues, but simply time and resources, I think, are the major concern in our discussions with the school that came up as the challenge.
Mm-hmm.
And I would just add on the particular issues of schools, don't forget that there's kind of this big procurement piece as well. And so, I want to install a rack that won't have bypass is probably going to be a harder sell relative than I want to install this magic air cleaning device that gets rid of 99.99% of COVID. And so I think that there's an education piece that's not just the installers and so on, it's up the chain as well.
And just to clarify, Jeff was being sarcastic when he said he was quoting what the salesperson would say, that it removes 99.99% of COVID, not that there is that magical device that's going to remove 99.99% of COVID.
Great. There's a question for you, Elliot. He said that I see black carbon is reduced in the afternoon. So do you see there's a level where we should not allow any outdoor activities at a school?
Yeah, that's a really challenging question to answer, and it was at the crux of one of the major issues of the work we did with that school district. I mean, I think the short answer is no, there's not a specific number at which you might confidently say, don't let children outside to play in the park adjacent to the school. I mean, there are no federal standards for black carbon in Oregon. We have what are called the ambient benchmark concentrations those are, however, based on a 1 in a million excess cancer risk and don't address, the question of, if I go out today, right now, when black carbon is elevated, what's my additional incremental risk? I think the jury is out, and that's a really difficult question to answer. There is some data that shows that short-term exposures to traffic-related air pollution, even on the order of minutes, have been associated with certain, cardiovascular metrics, things like increased heart rate. And so I think there is certainly enough there to exercise caution and try and ensure that your practices and your administrative controls, let's call them, are in place to try and reduce student exposures. But, there's a lot that goes into that. It becomes quickly a very political process to say, where can students go? When can they go there? What is outdoor recess going to look like at a near roadway school is a hugely challenging question to answer. There's a lot of different factors in addition to air quality that need to be considered. But hopefully the data and what we know about traffic-related air pollution, there are some relatively simple things that can be put in place to help reduce exposures. And I think given the ease at which that could be done, it's a good idea to try and drive down that exposure as low as possible based on what we know.
Mm-hmm. And I have a follow-up question. There's a school that you worked with, and I know that Portland had saw pretty bad wildfires last summer. How do they get good success in trying to keep the wildfire smoke out? And what do you get some your anecdotes experience with that system?
Yeah, so it's a great question, and I'm glad you brought it up, because I think the idea that what we do to improve air quality, there are other benefits if you install air cleaning to address a near roadway environment, then you're probably also targeting many of the same pollutants that might be elevated in a wildfire. We weren't doing our intensive monitoring during the wildfire events, but we did still have low-cost particle monitors in the school. At the time, they were little purple air monitors that gave us some idea of how well the intervention was working, and it did quite a good job at keeping PM 2.5 levels low inside the school during the wildfire event. And so we had been discussing with the school district and the local county department of health as the possibility of using the school as sort of a clean air shelter for those who might be looking to reduce their exposure during a wildfire. I think that's an interesting opportunity. There's a lot that might go into that, and COVID essentially derailed that idea. Convening people all in a school during COVID, made that even more challenging.
Great. Brett, you have a raised hand.
Thanks. Yeah, so this question is for Elliot, but Jeb may want to take it too. It's both a residential and a school component, especially an equity issue. We're talking about these air cleaning technologies. They're presuming we have the windows closed. And I'm just wondering if you could talk a little bit about the challenges of air cleaning in places where you don't have mechanical cooling, which unfortunately there's still many schools around the country, in places that maybe traditionally didn't need it because they didn't have to deal with that many warm weather days during the school year. Climate change, much more of an issue. And the challenges of sort of maintaining good indoor air quality in places where polluted, it could be urban, could be near roadway, could be wildfire, when you don't have cooling and potential benefits of that.
I'll just jump on it. It's a huge issue in Portland. Many of the public schools, like you mentioned, in Portland historically a mild climate, not necessarily cooling systems in every school. So it certainly is a challenge. In sort of looking across the literature, there was at least one study that was the described reason for their substantial reduction in realized intervention effectiveness was the school did not have cooling systems. And so when people were present, the windows were open to provide ventilation and cooling, and it substantially reduced the effectiveness of their standalone air cleaning intervention. And so, yeah, it's a huge challenge, and it's a huge issue. At Harry Tubman Middle School, there was a substantial investment made to renovate and provide cooling and mechanical systems. And then with that, at least on the face of the building oriented towards the freeway, there are now no longer operable windows to try and reduce infiltration from the freeway. But this was a years-long effort and a substantial investment to improve this issue in one school. So I think it's a major challenge that school districts are going to be faced with.
Just one other quick note I wanted to call out to EPA has a Tools for Schools program. So if anybody online is watching this and wondering what can I do to recommend to my school to do something to understand and do air quality issues better, that covers a lot of these issues of how you do ventilation checks, filtration checks, regular maintenance plans, et cetera. So Tools for Schools, EPA, great resources there.
Right,
So I just
you.
want to add to that from the residential perspective, and I don't have much to add to the details of what Elliot said, other than to say, I think that this is a reason why we really do have to think about portable air cleaners in residences much more than we do. And of course, the open windows problem, that's more a behavioral consumer education issue. But I think in climates where the windows are closed, or times a year when the windows are closed, then portable air cleaners often make more sense than trying to do something with a central system that has challenges.
Well, I see a couple more raised hands from our committee. Kim?
Yeah, so I have been helping a lot of schools reopen, and I've heard a lot in this discussion about filtration and ventilation, but probably the most common procedure that's being used in schools has been plexiglass barriers. And so I'm just wondering if you could somebody could make a general comment on, comparing plexiglass barriers. Are those protecting you against, I'll give you the hint, infectious aerosols or not?
Well, I'll jump right in and say plexiglass barriers protect against very large droplets, which are not responsible for the most infection. I do think thinking about physical distancing and people management is important, but we're not addressing a big risk with those barriers.
If anybody else wants to comment, that was a clear answer. Thanks, Jeff.
Did I see another raised hand from Stuart?
Yes, can you hear me?
Yep.
Yeah, back to schools. Schools represent a very diverse set of buildings with many different types of ventilation systems. Many times the filters are very hard to get to. You actually have to unscrew the units. Unit vents are really common. It can be tough to change out filters. I think we need to think about the design of these mechanical systems a lot. DOAS, dedicated outside air systems, also have the opportunity to provide better filtration for outside air and not treat the recirc air as well. I'm curious about your thoughts on these, and maybe this goes to Elliot and Jeff especially.
Yeah, I think the school and mechanical contractor, in our case, they did look at a DOAS system, and I think there's a lot there that there's a lot of advantages there. Certainly in the context of a near roadway school, it would allow for a dedicated outdoor air supply with air cleaning to try and remediate that issue. So obviously then you're allowing for the provision of ventilation without exacerbating a different issue, which would be the introduction of outdoor air pollutants. The specific reasons, I was not privy to all the discussions of why the school ultimately went with a single air handler and what the sort of pros and cons were to treat that recirculating flow. But at least for this school, treating the recirculating flow as well at least offers some air cleaning that perhaps might address, like we were just discussing, aerosols of human origin that are of obviously high concern right now for infectious disease transmission.
Yeah. The only comment I would add to that is that maintenance is everything in a lot of systems. And so already we have a big maintenance gap in so many schools. And so, well, your point is very well taken, that we need better systems. I think that a better systems without the plan and the resources to maintain them to achieve their design intent is a real problem in many, maybe even most schools.
Yeah, if I could just follow up, what about the MERV A ratings to be able to maintain the efficiency is a little longer for some of these electret filters.
So MERV is the process of conditioning filters with with potassium chloride nanoparticles. That's an optional part of standard 52.2. I think it's a great thing to do, a great thing to require, but I will acknowledge that there's a fair amount of discussion in the filtration community that not everyone in the filtration industry believes that it's accurate in its representation of how filters decline. But in general, I think it's a good idea. It's another piece of information, even if not always perfect.
Thank you. I see another question from Elizabeth.
Thanks. Those were terrific talks. I had sort of a broader question for the panel about schools, and there have been some discussion about resources and you know, the need to have also, you know, time and personnel and so on and so forth in order to maintain systems or install them. I think one of the challenges is the children who are most vulnerable are often in schools that don't just kind of lack resources on the margins, but struggle to keep their schools heated. And so some of the discussions we're having are absolutely fantastic, but the schools that are poised to take advantage of switching out air filters more frequently, investing in maintenance, they should absolutely do that. We want good air quality for all of our kids, but there's a risk that we exacerbate disparities here unless there's some sort of solution to address you know, indoor air quality in buildings of schools that are in poor communities and disproportionately in communities of color.
I'll take one thought about that. It's an excellent point. Actually, I had two thoughts. Number one is there was a lot of money included in the Relief Act that just passed to support schools, and in many states, sadly not all, they can use that money to do facility repairs and upgrades. So it is an opportunity to improve some of the really poor systems and poor conditions in some of these schools. The other point I'll bring up is Jeff mentioned some of these unproven technologies. One of the great things is that while there is cost involved in maintaining the filters, replacing the filters regularly, and making the fixes of making sure there's an adequate filter compartment in the HVAC system, the schools, we all know and recognize that there's a importance of providing ventilation, so the mechanical system's operating. So it is definitely a cost, but it is actually, I think, in the grand scheme of all the challenges that we have with schools in under-resourced areas, this is one where the cost is, in many cases, not so great to greatly improve the conditions. So the cost of making sure there's a decent filter compartment, that there's the knowledge of what filters to order, and it gets into procurement process and the maintenance process, because even those under-resourced schools do have some regular maintenance. So if you can do those things, it's a relatively small lift to potentially greatly reduce exposure to some of the most vulnerable people in our society. So I do think it's a challenge, but I think it's one that maybe we can find the resources to achieve, and hopefully with infrastructure bills, et cetera, we'll see more resources for that.
And I would just add to that we have an opportunity here to address a really important exposure disparity, and so perhaps we should be looking at how we can address those communities, the schools in those communities first, as a way of addressing a broader health disparity.
Yeah, I agree with all that said. I'll add that what I think was effective in bringing these issues to the attention of the school board was community organizing, parents' concern. There are a couple of nonprofits in Portland, Oregon that are very attuned to air quality issues and specifically schools, as well as some local reporters who, advocate on the topic. So there was this sort of confluence of interests that all came together to make this issue central and to put potential solutions forward for the school board to, sort of force the consideration. So, I think there certainly needs to be that ecosystem of awareness and action to sort of bring these issues to attention and to have them acted upon.
Great. So I'm going to bring the discussion to Rangehood. There was a comment from the audience saying that asking for our thoughts on phasing out gas stoves as a solution. What's your thought on that, Brett?
It certainly eliminates one of the important exposures or multiple important exposures, both the ultrafine particles and the nitrogen oxides. Research we've done and others have shown that gas stoves used, especially again from an equity point of view, in smaller residences and with more cooking, can lead to really high exposures of nitrogen dioxide. So phasing out gas stoves could have important indoor air quality benefits. We point out though that at the margins, it doesn't remove the need for good ventilation, because the cooking itself can also produce pollutants that you need to manage. So yes, there's a climate benefit, there's an air quality benefit to removing gas stoves, especially if they're replaced with induction rather than just electric coil. The induction also are just fundamentally safer, so fewer house fires, fewer burns, things like that. So there's lots of advantages, especially if you can go to induction, but you're still going to have a need for kitchen ventilation when you do that.
Yeah, there's a related comment. It's still very hard to find quiet Rangehood. So even with remote fan at a reasonable cost. So what's the manufacturer's thinking on this to make this technology more accessible?
I think the manufacturer's thinking is that as long as it's not required, then quieter Rangehoods will continue to be an upsell or a feature. You can get quiet Rangehoods, you just have to pay more for them. And if it can be put into standards that they must be more quiet, then that will, I think, bring the cost down, because they will become higher volume to produce the quieter Rangehoods. And again, our colleague, Ian Walker, who heads the ASHRAE committee working on this, they're actively working on this, trying to upgrade that standard to require hoods to have lower sound levels at higher flows.
Okay, so we have 2 minutes left. I think there's one question from the audience that was really good. I apply for all three of the speakers. It's around the idea of sensors are getting better. I see that in all your research, use some sort of low-cost sensor, low-cost monitors. So what monitors are you using? Do you think there's a big advantage of using that to try to understand the in situ performance of these filtration system?
All right, maybe I'll just jump in first and say I use a bunch of different low-cost monitors, and there's many good ones on the market. I would encourage people to go back to Dusan's presentation in week 2, went through kind of some of the issues. I think it's important to use monitors in a relative sense. I think it's really important to understand the monitor you're using and its response. And I don't think that low-cost monitors eliminate the need for using more sophisticated instrumentation, but I certainly think they have a huge role in helping us improve the performance of filtration.
I agree with that. I think, like I mentioned already, the monitors, that we had in the school during the wildfire event, gave some assurance that the system was working, and conceivably could, convince people that the air is better in this environment if you're concerned about it. I think it's certainly, like Jeff mentioned, not a replacement for research grade monitors, but I think, Jeff, you mentioned this in your talk. I liked the idea of sort of considering it like a in addition to a temperature sensor, an additional metric to kind of understand what's happening in your building, what's going on. I think there's certainly a lot of potential for the use for monitors like that in schools and other indoor environments.
There's a test method for low-cost PM sensors that is moving its way through ASTM that hopefully when that is produced, it will at least allow a consistent standard to be applied. So monitors could then advertise that they have achieved a certain performance level on this narrow test. It's kind of like the 52.2 filter test. It will be imperfect for sure, but it's at least some general reference, and it'll help consumers distinguish between something that doesn't work at all from something that works pretty well.
Great. All right. That's all the time we have for the discussion. Thank you so much for all three speakers. We will break for 10 minutes. We'll be back at the top of the hour, and then we'll start section 2. Thank you.